Leader of the third party.
Thank you, Honourable Speaker. On Tuesday, we asked the Minister of Health what he's doing to not only recruit but retain nurses. And although this healthcare system is failing to create the conditions needed to retain nurses, it has been great at hiring and retaining corporate and executive staff. We are encouraged by the bilateral agreement between BC and the federal government to support healthcare in our province, but there are concerns that these funds will be spent on administration rather than the systems and people in need. Through you, Honourable Speaker, to the Minister of Health, can he assure the people of BC that all of the money transferred will go to improve frontline healthcare delivery rather than administration, and that there will be complete transparency on how that money is spent?
Minister of Health.
Thank you, Honourable Speaker. Indeed, we have a bilateral agreement with the federal government for the next 3 years. Of that money, $200 million this year, $250 next year, $300 the following year will go to support our nurse ratio proposal, which we worked on together with nurses across British Columbia. Another $246 million of that money will go to support the continuing support for mental health and addiction programs that are so important in this time when so many people are at risk in this province, both from mental health and addiction issues. The amounts of monies are going to are detailed in the agreement, and they support the government's initiatives to hire frontline healthcare workers, of which we set records this year and will continue to set records, I believe, in hiring new people, and that includes doctors and nurses and health science professionals and healthcare workers.
Leader of third party supplemental.
Thank you, Honourable Speaker, and there has indeed been record-setting spending. 2016 to 2017, the Ministry of Health spent $1.42 billion on administrative costs, $288 per person in BC. In 2022-23, that spending skyrocketed to $3.26 billion, $603 for every person in BC. And yet the population of BC only increased 10% during this time. Health administrative costs have more than doubled, with executives at the top being paid hundreds of thousands of dollars, while nurses in Prince Rupert are having to use the food bank because they can't make ends meet. 1 in 5 British Columbians do not have primary care. We have a shortage of over 5,000 nurses in the public system. ERs are closed more and more regularly. We are sending cancer patients to the US, and yet administrative spending in this province has ballooned. Through you, Honourable Speaker, to the Minister of Health, how can the Minister justify the massive expansion in ministerial and administrative spending in healthcare while British Columbians are languishing?
Minister of Health.
Thank you, Honourable Speaker. And these things are actually measured by the Canadian Institute for Health Information. BC has some of the lowest administrative costs in the country for healthcare. And that share of administrative costs, which are measured every single year, the share of healthcare expenditures have gone down since I've been Minister of Health. We have been investing record amounts in frontline healthcare workers. So we have 5,221 net new nurses this year, Honourable Speaker. We've set records for surgeries, for diagnostic testing, and I think the healthcare system has led us through very challenging circumstances and 2 public health emergencies. I would note, for example, amongst those administrative costs are the amounts spent on PPE in our healthcare system, which is vitally important and, as everyone knows, increased dramatically during the pandemic because of international conditions. But I don't apologize for spending money on PPE to keep healthcare workers safe.